Hi, I'm Dr. Oscar Marin, and I'd like to welcome you to our practice. This video was developed in order to help you get better acquainted with our philosophy of treatment and basic office operation procedures. During your 6 months initiation period, you will be introduced to your positions manual. That manual is your reference guide for general and everyday tasks, and it will enable you to have a complete understanding of your job duties. Let me begin by saying that we're all very proud of working at our practice, and we take our role as dental healthcare providers very seriously. If I could point at one thing that sets us apart from other dental offices, is that we all share a passion for doing things right, and we all take a personal interest in making sure we deliver more than expected with great attitude and service. A patient is always welcome to our office like we would our friends or relatives. People have many reservations about the dental visit, and a welcoming, friendly atmosphere is crucial to develop trust and confidence in us. That being said, when greeting a patient, be very polite. Start by introducing yourself, say your name and your position clearly, establish eye contact, and most important of all, smile. This may sound very simple, but it's one of the hardest traits to find in people these days. You can follow up with an informal comment or a question that takes their mind off the dental office. Apologize for having them wait, or thank them for being patient or for being on time. You can compliment their attire only if it's a genuine compliment. This is the time to exercise your creativity for casual conversation. Develop a true interest in the patient without invading personal privacy. You may also want to share something about you that is not too personal. Once the patient is in the operatory, spend a couple of minutes discussing what will be taking place during the appointment. Just be careful not to be too descriptive when talking about procedures. Don't talk about shots or drills. Instead, talk about preparing the tooth or taking a mold. Make sure you don't place any sharp, threatening instruments or lap cases in the patient's tray until the patient is lying back ready to start with the procedure. During your first weeks at our office, you may find that some days are busier than others. If you find yourself wondering what to do next, please ask your immediate superior in what area help is needed. And after a couple of weeks, you must be able to anticipate the needs of the office without constant supervision. Try to use common sense when prioritizing tasks. When there are several things to do at the same time, help resolve the most important issue at the moment. To better understand these, see what will help patients move in and out of the office more efficiently. So for example, if instruments need to be cleaned and charts need to be filed, and the rooms are dirty and there's patients in the waiting area, then get the rooms ready and the patients in and out as soon as possible. Promoting the office is essential for the productivity of the practice, and you should take any available opportunity to motivate people to come to visit us. This is an asset that we value most in our employees. We look for people who are willing to encourage others to get their oral health in check. Get yourself familiarized with all aspects of patients' findings and treatment. Once treatment has been recommended, we all need to try our best to help the patient accomplish their dental health goals. You must always reassure patients about the treatment being done and encourage them to get pending treatment completed. Once all the treatment plan has been rendered, our goal is to help keep the patient health on track. Remind patients about the importance of their periodic cleaning and maintenance appointment. It is the only way we can keep deteriorating conditions or compromised areas from getting worse.